I've asked this question before.
Hmm.
How do we motivate people to do something, to say, I need to have the conversation? How do you motivate people to have a conversation?
Okay. This is just my opinion. This is just what I believe when I answer this. Two things. When it comes down to that, procrastination and pressure. So what happens is that when they see so much information that is actually being given to them, that's when that kicks in. And it's like, how am I going to be able to do all of this? And then going back to what you said, it's better to talk to an agent in person so you could be more better prepared and not do it online.
Good morning, Darrell.
Morning, Raymond. How are you doing?
Um, it's an interesting weekend. I think I'm awake.
Man, it look like you've been pretty busy here, man.
I have done, I mean, you're talking about tasks that I performed this morning?
Yeah.
Yes, how'd you know?
Actually, I didn't. It was just you talking. So I really didn't. It just looked like you was just I mean, just by the looks and gestures, it just seemed like you just been busy. You look like you just really and you look like you have on a uniform.
No, it's just it's layered. It's still a little bit cold here. We're now in the entering the spring season in Washington State. But it's been a
Oh,
cold and overcast um 6 months. So I'm
yeah.
now obviously I just said I'm in Washington State. Now where are you located?
I'm located in Indianapolis, Indiana.
Oh, okay. So
Yeah,
are
I'm in
you
the
in
US.
Eastern time?
Yes, Eastern Indiana time. Yep.
Oh, okay. I always forget, whether it's Indiana Central or Eastern, but obviously,
I think they have Eastern Indiana now.
yeah,
Or unless that's daylight savings. It's one of the two. But I
yeah.
know it's Indiana time, so I know that.
Well, there are a lot of people that would like it either keep it standard time or keep it daylight savings time. Um, in some ways, I understand, but I collect clocks, so I have to, every 6 months change all the clocks manually because
Yeah.
that. However, most people just have, and most people used to have, desk clocks or they'd have
Yeah.
but now it automatically changes on their phone.
Mhm.
Well, actually, I lied. When you consider on appliances and things,
Yes. Yeah, that's mine because I like to do uh like every time the time changes, I always like to keep the appliances, on the same time and let the phone change itself. And so that way, when it comes down to keep changing the clocks, it'll just be just like it because the phone will automatically change and I ain't gotta change nothing for, the appliances and the wall clocks and stuff like that. So I just leave that be.
the thing that I'm also cautious. I mean that's just for some people they just like to complain.
It's,
Uh,
yeah.
the thing that I am concerned about is with all these electric vehicles and appliances, all the monitoring,
Yeah.
where unless you know how to turn it off or um, that you're monitored just as you are when you're out in public with these television cameras, is
Yeah.
that how much data is absorbed. And it's not just like my car. I have an electric vehicle, not just my car data, and that's fine. I mean, it's nice to know see it on my application or on the computer. What I am concerned about is what other kind of data are they getting on me, or can they also are they getting voice data?
Yeah. That's an interesting point. That's an interesting point. So
Yeah,
yeah. Yeah, I can understand that point though.
understood. Well, look, let's do a podcast. What do you want to do?
Sure. I mean, I'm already recording, so we can
Oh,
knock this baby
really?
on that. Yeah, I'm already recording. We go ahead and knock this out real quick.
See, you see, it was monitoring, and I didn't even know you were recording, Darrell. It's good thing I didn't give you my social security number.
Man, you knew you weren't gonna do that. You weren't gonna give me no social security number. Y'all have no reason to use it.
You never,
Hackers do, but not me.
well,
Like
it um
I'm just saying. I was just
a lot
saying,
of
man.
I've been doing a lot of transactions, banking transactions.
Yeah,
Uh, the issue with credit cards and banking is
man.
it is a shit show
It
of
is.
problems.
No, you're good. No, you can let that fly, man. I'm good with it. I'm good with it.
Yeah. All right. Well, anyway, what do you want to talk about? What do you want
Well,
to?
let's talk about you. We
Oh
got to
God.
talk about you. Yes, we got to talk about you, man.
Oh
We got to
no.
talk about what you do, man, because I am interested. I am so
Uh,
interested in what you do because you said a lot when you emailed me, and I got to know your perspective on some things. I really
uh,
do. So I want to know firsthand, like you, what do you do? How'd you get into this work? And what kind of put you into the predicament to actually speak on it?
it's been a process, but let me tell you what I am, and I'll tell you what I do. People say, "What do you do?" And people say, "Well, I'm a lawyer, or I'm a
Yeah.
whatever." I'm a I do plumbing. Uh, um, that's what you are. But what do you really, what do you do? Well, if you're an electrician, I'll tell you, or a plumber, you make people very happy. Why? Because if you don't have the plumbing, um, you got problems. If you don't have electricity, you have issues. Or if you say I'm a vehicle technician, it used to be a mechanic, but now you're a tech.
Right. Yeah.
Is it I'll fix your vehicle, or I'll try. But what I am is I sell long-term care insurance. I call myself an extended care benefits advisor. But what I really do is I advocate for people to have a caregiving plan as part of their life plan or state plan, whatever kind of plan you want to call it, so that when and if you need caregiving services, not healthcare services, but caregiving.
Caregiving.
What's the difference? Difference is one is health insurance pays for your health, for your doctor or your physician or at a hospital.
Right.
That's what your health, because you're sick, you have the flu, you have some major illness, some frailty, something has happened where you need a doctor. That isn't what I do. What I advocate is people have a caregiving plan, whether it's long-term care insurance, whether if they really want to do pay for it themselves, what's the economic cost? But it's caregiving where it's something in your health history necessitates that you need caregiving from either family, friends, licensed caregivers in your home, or that you're in a care facility. Call it assisted living, call it nursing home, call it cognitive care center. Uh, but these are things that people sort of know, they'd love to avoid, and they don't really understand.
Excuse me. I
It's
had to
okay.
call.
No, nobody. People always say that, and I always say, nobody's mad at you. That's my phrase. Rather than, I do it to say I acknowledge. It's a way of what Raymond was saying is I acknowledge that an issue happened and it's going to happen. Maybe being doing this for as long as I have, I become more patient about it. When I first got started I mean, I've been involved in financial services for decades, and I've been
Ooh.
involved in commercial banking and mortgage banking and insurance and all kinds of things.
Yeah.
But for some reason, with long-term care benefits, at first I was really impatient about it. It's like, why don't you, people, why don't you get this? Or why are you asking me these questions? And as time comes on, as proceeded, I've come to understand, I think, what it is that people are fearful of, or what they're in denial, is that at any age, let me just say this: when I am talking about long-term care insurance, or caregiving, people sometimes, you either have this, sort of, I don't want to talk about it, I don't want to think about it, or the glaze or the look. Um, but I think what I've come to, my analysis, is that I think people just don't want to come to terms with things are going to happen to you. And the issue isn't that things are going to happen to you. It's like,
Yeah.
you wake up and you find out you can't find your sock. You didn't sleep as well, so you're a little bit tired. You can't find your glasses. I mean, you have a lot of, I've often said that, if you want to find out somebody's mental health, find out how the day began. You asked me, actually, had I been busy, but if your day is disrupted, it just doesn't begin the way that you want. Everything else seems to be out of sorts. But
Yeah.
when you're thinking about, caregiving, you are out of sorts. It means that either you have to help somebody, or somebody has to help you.
Yeah.
And it's disconcerting, because why? Because we're not trained for it.
Yeah.
I mean, not even, and I'll give you an example. No matter how many books you read about parenting, parenting is sometimes it's just in time. You have to sort of, think about it. You're not practiced and prepared. You don't get
Yeah.
a certificate of competency in parenting.
Yeah.
Or if they do, I'm not aware of it. But and so you make mistakes in parenting. Uh,
Hmm.
but what I've also learned, about this caregiving, is that we all have to learn certain things, just as you do in parenting. One of them is the most is you got to that those that need caregiving and those that are care need to learn how to communicate. And what
Right.
I mean by communicating is, it's okay to say I'm not feeling well. It's okay to say, I'm frustrated. It's okay to say I'm feeling invisible. I need attention. I'm feeling vulnerable. It's okay. And I think it's all, but I'll tell you what's not okay is it's not okay if people are mean to each other, or angry, or frustrated. It's, for momentary, it's fine. But if it happens every day, then you need intervention.
Yeah.
And what I mean by intervention is you need to get, other family, or you need to get, if you want to be faith-based, or if you want a gerontologist or mental, is that it's like John McCain said, it's always dark before it becomes black. And what
Right.
I mean by that is that if you have a situation where you're needing caregiving, and there's disruption, there's chaos, there's anger, there's annoyance, there's frustration,
Hmm.
is that it never gets better until, somebody says, look, we need to talk this out and figure out, how we can be calm. Because in caregiving, it isn't just, look, what I do is I provide the money. That's my advocacy, is if
Yeah.
you want, if you're going to be in this situation, it's a lot better if you have funds that you can hire people and you can do things so you can still have a life. And I also emphasize, you can still have a life. I know that personally, with my parents. They had a life even though they needed caregiving. It was a
Yeah.
pretty good life. But they had the resources and the support system that they could do the things that they want to do.
Sure.
And there are lots of people that you may know or not know when you're in public, that are in caregiving. You just don't know it, or they need assistance. They may have autism, they may have a neurological, and it isn't just elderly. You always think of, when long-term care benefits first came, it was called, nursing home insurance. And I'll tell you, I wasn't a fan of saying, gee, I'm not going to a nursing home. Actually, as time goes on and I'm in my 70s, I'm I am convinced I'm not nursing home material. I'm not nursing home relationship material. I'm just not.
Right.
Because because and I'm not. I, I lived in a homeowners association for a while, and I didn't do well. I'm not homeowners association
Man, I
material.
I agree.
Yeah.
Yeah, it's tough.
So, so for most people, if they had a choice to say, because it's also fear too, to say, oh, we're going to put you in a nursing home. There's fear of, where's the nursing home? Where's it going to be? Are people going to pay attention to me? Will I have visitors? You mean I'm going to be in a bed? Am I going to be with other people? And depending on your lifestyle, if you've been a loner or you have a spouse or partner, you really want to be in a nursing home that looks institutional,
Yeah.
or would you rather be at home where it's your home? And this is where caregiving benefits have changed, where it's no longer just nursing home or assisted living. It's really more structured towards people being remaining at home.
Yeah.
You have the right situation of you got to have the funds. Why? Because um, if you whether you rent or you own, whatever your non-care center living is, or you live with or you live with family, is that there's the expenses go on. There's no line item that I'm aware in your tax returns that says that you can take a deduction for your caregiving. And
Right.
or there's no deduction to say, hey, can I get a discount on my electrical bill? Can I get a discount on my property taxes? Maybe, I mean, at certain ages you can, but our American system is not built to really help people that need caregiving.
Correct.
It just is. And I'll also say, if you want, is that it's not a good idea to be poor in America. Even if you think that, and there are a lot of there are a lot of reasons for it, but one of them is the people think that the social services or Medicaid or Medicare is going to solve all your problems. It isn't. It's there. It was designed to do certain things. However, it is in some ways, if it works out, fine. But if not, then you have to deal with the anxiety of, will they approve my benefits? Even if they approve it, will they pay the benefits? Even if they pay the benefits, how much are the benefits? And what I've also learned is that just because you're entitled doesn't, I mean, excuse me, just because you're eligible doesn't mean you're entitled.
Right.
Meaning, and to explain that is I'm a veteran. I'm eligible for things, but I'm not entitled because I have to qualify. And then if I do, then I'm at the if you don't like the word mercy, is that somebody else will make choices for me about
Right.
hours, caregivers, and supposing you don't get along with that caregiver or they don't get along with you, can you get somebody else and what's the process? And most people, including me, Raymond Levine, I like to make my own choices. Of
Heck
course,
yeah.
most times I like to consult my wife to make sure that it's really, that there's something in my decision
Yeah.
that might be better than than if I decide. But the point is, most people want to make their own choices, meaning
Sure.
who do they want to hire, and also you have to learn how to take the services of a caregiver. Once we leave childhood, most of it, and even when you're, 6 year, I'm big enough, I'm grown, I can do it myself. Well, think about it if you're an adult, and he says, "Don't tell me what to do." I mean, they and they will. So you have to learn how to be a caregiver, but you also
Mhm.
have to, well, or you have to learn how to accept caregiving. Um, and if you're not used to it, then either take a YouTube class, take a community class, take some, or have whether you want faith-based divine or people to come in and say, look. You need caregiving, you need help. They're trying to help you. You're being difficult. I won't use other forms of it, but I'm sure your listening audience will get the plot. Is
Yeah.
that and most people know that. Of course, you also have the others where, and I'll just say it as a long, being in this business a long time, that caregiving is mostly, is all about the human interaction, but
Mhm.
another big portion, it's all about the money. And the money
Right.
means that, sometimes families are not always as gracious as you think they are, meaning sometimes they might say, can we cut the caregiving? How do we cut the caregiving expenses? Do we really need these people? How many hours do you need? Do you really need this? If you're in a care, you really need this nice a place. Let's get that's costing you 10,000. Let's get you in one that costs you 5,000 a month. Um, or people who are worried about saying, well, if you didn't plan, or you thought you did, and you're needing caregiving for a longer period of time, your assets are dwindling, and then family become considered, hey, maybe I'm not going to get as big an inheritance because you're using the money for caregiving. This is the reason when I have that conversation is to say you have choices, and whatever choice you make, that's what you're going to have to live with. And look, also, if depending on your age and your relationship with your family,
Right. Mhm.
that sometimes people have your best interest in mind, sometimes they don't. So if you have a caregiving plan that you've established in advance, and you've had the conversation, people, look, this is how I want my caregiving. I mean, people have better plans about their death than they do plans about what happens when you transition from an active lifestyle to you need caregiving. Most don't have that kind of plan, but they might plan meticulously about, do I want to be cremated? Do I want to be buried? Where, why, and how? And the services. Some people have, the hymns and the songs and the, all the other things,
Sure.
but they don't always plan to say, well, what's going to happen to you before you make that transition, the big leap, the big jump. And these are things that I work with people or try to encourage people, to have that conversation. Now, if you have it with me, I try to make it, not it isn't, I don't make it as if it's humorous, fun, let's have a comedy show about this, but I will
Yeah.
try to do it where it's saying, tell me your story about if you needed care, what do you want it to do? Not just, oh, how much it costs and the anxiety and all that stuff. I
Mhm.
mean, you don't go to a restaurant to get depressed. You go there because you want a nice meal.
Yeah.
Uh, you don't go to the car dealership because you want to be, well, I mean, buying a car can be an interesting experience, but in most situations, you go out and you buy things, you do things, you take rather than the car deal, we'll talk about taking a vacation. You know, taking a vacation is a wonderful, pleasurable thing. That you'll plan your vacation sometimes in more detail than you plan your caregiving. Why?
Right.
Because it's fun. You know,
Hmm.
wherever you're going to go, you'll plan, the plane or the car, where you're going to go, where you're going to stay, what you're going to do, and that's fun, hopefully. But what people aren't doing is, something that not only is more expensive, but also could be longer term of what are you going to do? How are you planning your life? How are you planning your retirement? How are you planning your estate? Um, and at what point, if you're not, however you're working and making money at whatever
Hmm.
age, at some point,
Right.
it all has to stop because, or let me just say it another way. If you have a quality caregiving plan, even if you need caregivers, you can still work, you can still do things. You know,
Sure.
pro- it, either somebody can get you to the office if you have to go to the office, or you can do things, at home or some satellite center. to do things. You can still do it. The difference is that you need assistance. If you have a neurological
Hmm.
disease, you can still work depending on what you might not be able to work at maybe what you have been doing, but you
Yeah.
still but you need caregiving. In other words, you need a support system,
Yes.
and everybody need and whether you hire them or their family, there's still an economic cost. If somebody can't work, well, then they're not making money. If they're not making money, then who's going to pay them? And it's the
Hmm.
same as, or if you hire people, or if you have a spouse or partner, are they really capable, or do they have a career? And again, for my parents, they were both lawyers. My mother was an estate planning lawyer, and my father did civil litigation. And so, different times in their lives, especially my father, he had very long caregiving experiences, of which my mother had to either not being she had to take a sabbatical from her practice, or she couldn't work as full time. She had to take care of him, and they weren't insurance
Yeah.
buyers, they were planners in some sense. And you would think, estate plan, but they weren't. And I also weren't insurance buyers. They bought the insurance that they needed, but it wasn't until they were in their 70s that they finally said, gee, maybe we need to get long-term care insurance. My father couldn't because he had pre-existing condition. My mother got it. And interesting enough, she used it for 18 years. She died a couple of years ago at 103. And she needed it. I mean, for 18 years.
Absolutely. Yeah.
So it was a good benefit. Now, she was actually a classic case. When people ask me, well, when will I need my caregiving and how long? My answer is it depends on your family history. It depends
Hmm.
on, a variety of factors, and also it depends on your health, your health assessment, plans and in what state, because different, not all plans, long-term care benefits is not a national plan. It is a state plan. So each insurance commissioner can decide what they want to approve. So some states have more a variety of plans. Other states don't have. For example, in Washington State, we don't have offer short-term care plans. We have a few, it, and it just exasperates me. And the reason it exasperates me is we're saying we don't want as many people to be dependent on Medicaid. We don't want people to be as to rely on social services. Well, then if
Right.
you don't want people to do that, then offer plans that have two things: one, that they're more flexible about your health assessment, and two, that the premiums aren't as high. Short-term care plans can actually be very reasonably priced and as good in some ways, or even better than even a regular long-term care plan. But you can't get what you can't get if it's if,
Right.
if it's not available. So it's a hypocrisy that's what happens. Because so when people say, well, Raymond, long-term care insurance is expensive. So if you think long-term care insurance is expensive, try not having a long-term care benefits and see there was a point is, would you rather spend two, three, 400 a month to get maybe three, 400,000? Or would you rather use your own two, three, 400,000 of your own assets to pay for your care? What do you think is the better deal?
The benefits.
Yeah, eh, because you're leveraging your benefits.
Yeah.
So, it's it's a good investment because you'll get back a lot more than what you put in. You
Absolutely.
might not think it is, but you do. Or even with a short-term care benefit. I mean, there's some benefit plans that can be 1 or 2 years. You can get $1 million, $1 million, not for 125, 130 a month. I think that's if you needed all of that, that's a good deal.
Absolutely.
Yeah.
Absolutely.
Hmm.
Now, what catches people off guard the most? Because most people don't be prepared for this. And they go in and they think they are, but they're not. So what catches people off guard the most?
Well, off guard about having to talk to Raymond Levine. What are they off guard about? what do they feel off guard, or what do you mean by people are off
Okay, so
guard?
like,
Because I want to know what off guard means so that I know how to
okay,
answer.
well, it could be in the base of either just like getting caregiving benefits, or in the base of yours of Raymond Levine. Either one.
I'll give you a truism. People, we're sort of used to talking to salespeople. Now, it's less, I don't want to talk to a salesperson. I'd rather do it online. I'd rather do it myself.
Yeah, that's
Um,
me.
and and so you can buy things online. You don't have to go to a store and talk to a salesperson
Right.
because we're annoying and we're asking questions and we're hovering and all the other things. So
Yeah.
uh um but when it comes to buying insurance, if you want to buy it online. The odds are though that it's very likely you're going to make buying mistakes because you're just looking at, it's a one-way conversation. It'll tell you, do you want this, you want that? I don't know, I don't need that, I don't need that writer. Well, unless somebody can explain or ask you, or you can ask them, you may say, no, I don't need that. So you may say, oh, I have this premium, I can afford this premium. People forget the premium when they need the benefits. 100%. They will forget that. They'll just say, I own this. I have this issue. Pay me. And the insurance company will say, we'd love to pay you, except you didn't buy this rider. You didn't buy this. So we'll do this, but we won't do that. And then they're angry. Oh, the insurance companies, they took my money. Well, yes, they took your premium. However, you bought a contract and it says this. Now, if you think that you really are owed it, I, as an insurance agent, will say, if if I see it, I say it seems reasonable. If the insurance company doesn't pay, then I would advise you see an attorney. Have them, look at the contract, and if they
There
think
you
that
go.
it's, that you're owed money, have them write a letter. Assume if you have to,
Yeah.
because I sell benefits. That's what I do.
Mhm.
But are there issues with it? Yeah, I'll tell you one of the big issues if you want a long-term care plan
Mhm.
is that people think that if they have a health issue, that then they can immediately file for benefits, a claim. And that's not exactly the way it works. Is that a caregiving plan will only be activated when a physician certifies that you need caregiving and it's going to be for at least 90 days, that the health has done something to you. It's not just that you have cancer. It's not just that you have a neurological. It's not just that you had a stroke. It's not that you're recovering from accident. Obviously, you have a health issue, but if
Right.
you can show that, hey, this has caused something where I'm going to need somebody to take care of me because it's affected activities of daily living, eating,
Yeah.
bathing, dressing, cognitive. The illness or the frailty or the accident has done something where you need caregiving services. Then the carrier will say, we approve. We will wire you the money, or we'll send you a check, or how, depending on the plan. So this is where people get upset with saying, well, I didn't get my benefits. They denied me. Well, uh, uh, in most cases, they deny because either you weren't ready, or in some cases, because you didn't file the claim in the way that they needed. And if
Right.
they, whether you're a client of mine or not, if you in that situation, call me. I'll refer you to people that that will look at the plan to say, they'll help you get the benefits if you fit that criteria. And,
Mhm.
you might think that, well, their insurance, they just want my money and, they want to hold back making payments. Any good insurance company that has offered long-term care plans does want to pay you. Why? Because first they want to pay you, but also they don't want the bad publicity. And this is
Right.
so, long-term care benefits for a number of years has gotten bad publicity. It's too expensive. They don't pay. It's all, any negative thing to say, don't do it. Well, let me give it. Mortgages in 15 years ago, people had mortgages and they lost them because they couldn't pay the monthly mortgage payment, so they lost their home. People still buying homes or want to buy homes. Banking has had issues. I can't think of anything that hasn't had a problem. But when it comes to things that people want, they'll forget or they'll overcome. But for whatever reason, with long-term care benefit, it sort of hasn't overcome. It hasn't regained the gee. It's a good idea. It always defaults to it's too expensive or they won't do this. Well, it has had problems. I don't deny it hasn't had problems. What I can
Mhm.
tell you is we've learned from our, mistakes, our errors. And what was the issue? The issue was premiums. Premiums went up because of what happened with the mortgage defaults in 2008 through 2010. So actuarially, the long-term care benefit, they raised the premiums. Why did they raise the premiums? One was because people were using it longer than they thought.
Yeah.
Uh, uh, um, um, the second is that the insurance companies did had actuarially what the return is, and when interest rates went to almost zero, that deflated the money they thought they made. And then for the big whammy, what people forget is that once people owned it and they started to see other people that needed caregiving, they said, "Hey, we're holding on to this. This is a good asset." So unlike life insurance, where they predicted, a good percentage of people in time will drop their life insurance, whether it's a permanent life insurance, whole life insurance, or term insurance, will drop it. What they were finding is there was less than 5% of the people who dropped their plan. Why? Because the living knew what say if I own it, I'm going to keep it. So you had very high retention, which the actuaries also misunderstood.
Yeah.
Um, so those are three reasons why there's all this annoyance, but it's gotten better. It is stricter with health assessment. That's true.
Yeah.
Underwriting is actually much better. It's much more efficient. And in some instances, actually premiums have gone down. But it is true, premiums are higher. However, if you notice lately, I don't notice my gas prices going down. Um,
Me
um,
neither.
my insurance benefit, my insurance has risen. My property taxes. I don't notice a lot of people say, "Wow, I'm angry. I'm gonna drop my house." You know, I'm gonna
Yeah. Yeah.
obviously you have to be more careful, but in all this long-term care benefits are not any more or less, they're not even any better or worse than other things. The thing that I advocate is you need it because it takes care of so many things in a person's life. And as I mentioned before, the three things that I think, and I say this to myself, is that one, I want attention. Raymond wants attention
Yeah.
when I need something. That doesn't mean I have to be um, obnoxious about it. It
Yeah.
doesn't mean that I need to be unpleasant. It doesn't mean that I need to be rude, but I want attention. The other thing
Absolutely.
is that I don't want to feel invisible. And when you need caregiving, if you're at home or in a care center, you can be very invisible because you're in a bed or or in time, you might begin to feel depression and
Yeah.
mental health issues. And the third is to feel vulnerable. And
Mhm.
I don't care how affluent you are, how learned, how good looking you are. Any is that most people, including me, I don't want to feel vulnerable. And I'll guarantee you, you want to feel vulnerable if you're not able to drive. If you can't take care of certain daily tasks, you're going to feel vulnerable. I mean, I had that personally. I've had two heart attacks, one in 2010 and one in 2015, and I was not amused. First of
Yeah.
all, because it was sudden, and I would and it was it was unexpected.
Yeah, man.
And so I was out of it for a number of months. Fortunately, I had I was ambulatory. Most things I could do, but my family was able to do things. But in the early time, um, they drove me. But we had, we had an infrastructure in place. But but and also I had mental health. I mean, I was depressed, saying, this happened to me. I'm annoyed. I'm inconvenienced, and I had to learn how to get through that. What's going to happen to somebody that needs caregiving for a year, 3 years, 4 years,
Mhm.
5 years, 6 years? Unless you reorient your lifestyle, you're not going to be a pleasant person, because if you can't bathe yourself or dress, or you don't want to have people over because your house is maintained, or you don't want to go out because it's an effort. Um, to dress yourself. If you have a support system, you can go out and do all that stuff. May not be able to do it as quickly, but you can have a life. I guarantee you, with my parents, they had a lifestyle, they had a support, they went out and did things, they had people that came over. It can and will be done. You just have to have the funds and the support system. You can do all you can do all these things.
No doubt. No doubt. You are like do benefits like caregiving benefits. Have you like actually done caregiving itself, like having an experience of caregiving itself, or just actually doing care benefits and stuff like that as an agent?
I have two answers for that.
Okay.
The first is that actually soon actually I'm going to be a caregiver for my wife who's going to need knee surgery. And actually, a number of times actually our daughter has had digestive issues. So yes, I have done, caregiving. It hasn't been for an extended period of time, but yeah,
Sure.
if I haven't been well, or my wife or my daughter hasn't been well, have I done it? Yeah, I mean, I've made, I've prepared food, I've done laundry, I've done just like I did, when I was actively parenting.
Sure.
I did driving, I picked up prescription. Yeah, I mean, it doesn't happen all the time, but yeah, in certain cases. Now, for longer term, I'll give you the second answer. Raymond is not a long-term care giver. It's just
Okay.
it's not part of. I'm not caregiving material.
Sure.
Uh, for a lot of issues, which is why we own a long-term care plan, which is also actually why we have even a short-term care plan, where if between the time that we may need our long-term care plan, we have a short-term care plan. It's actually a subscription plan, and that's
Mhm.
another. If you want to, if you have $95 to, I think it's 450, you can buy a subscription plan. You need no health other than you don't need to be currently on caregiving, that you can hire licensed caregivers to come in for a certain number of hours to take care of you. So we probably will do that. It's not because I'm not fond of my wife. It's not because I'm a rude person. It's just, I have also other things to do, that I'd rather hire somebody that will take care of things so I can do other things. And that's the other thing with caregivers, that those that are caregivers can feel isolated. They can feel depressed.
Yes.
They can feel overwhelmed. So it's not that I don't want to, care for my family. It's just in what way, and also it doesn't hurt to have, a support system, meaning other people. So will I do caregiving? Depends what it is. But I also have, the resources, because I have plans that will say we'll hire people to do certain things that either I don't want to do, or they may do it better. And there's also a third element in this, is that if you're going to stay at home, then as far in the future as you can, if you know, where you're going to say is begin home modifications.
Right.
People think, well, Raymond's just this long-term care life insurance salesperson that just wants to sell a plan so he can make a fee. Well, yeah, but I'm also doing it because I really, I advocate it, I care, it's happened to me. So if I can leave a legacy with as many people, they can, whether they remember me or not, to say, hey, when we need this, we got a plan so our lives are better.
Yeah.
To me, then I've lived, I think, a good life of significance. I've helped people that are going to need help. And so but I also have expanded on too of home modifications. Also have your documents in order, have it manual, certain things manually, print out your social security number, print out,
Mhm.
your insurance, or have your insurance manually, or also doing what I'm doing. I'm now starting to I subscribe to a company where I'm also going to digitally upload a lot of things, so that it's that it's available for me and for my family. And another thing, along with home modifications, having your documents in order, because that's the word. I've had more phone calls of people saying, "Hi, I'm at my parents' house and I can't find their health insurance. I don't know what their prescriptions are." So, have that stuff organized. Now, when I mean by organized, people say, I don't, I'm organized. I thought when I had my first heart attack, I was organized. I was not organized. With prescriptions. And so when I mean by organized is have your prescriptions written down. Actually, I even have a digital one if somebody wants to know about it. Have your doctors, who are your doctors? What are their phone numbers? If you want to, you can have their address, because this is also families want to know what prescriptions you're
Mhm.
taking. Where's your pharmacy? When's the last time you got the prescription? Are they being sent to you, or how do you order the prescriptions? Who's your dentist? Who's your optometrist, or your um, what's the ophthalmologist? So,
Mhm.
who's your cardiologist? Who's your neurologist? Who's your, these are things that if you have this in order, it makes it more agreeable, because you're not in anxiety about it, but also your family or people that are taking care of you. It's the anxiety and the
Yeah.
stress that people are under, and that's what makes it unpleasant. If you look, I'm not going to advocate to say, being ill, and if you have a long-term care benefit, it's wonderful, it's nirvana, you'll have happiness. You won't. What you will have is you will feel. Actually, I don't think I've ever said this on a podcast. You'll have control of your life.
There you go. Yep. Yep. Because I'll say this because I've seen this before. Like I have a family member that's actually, needs that, caregiving type of thing. And I see the caregivers and they're in and out. They around the clock, they work in shifts. And I can look at them and just see the overwhelming work that they have to do. I see the stress. I see the depression. I see the anxiety. They may not show it on the outside, but on the inside, it's telling a whole different story. It really is.
Mhm.
It really is because doing so much is really burning them out. And it's really getting them to a point where it's like, oh my goodness, I don't have time for myself. And you speak about it, you talk about it too.
And
And
and you've just told the story that we say, but if we say it, we're salespeople. If you say it,
mm-mm,
it's a story. It's meaningful, because they think that we're making this stuff up, or we're exaggerating it, and we're telling the same story that you're saying. But
yeah,
why would they believe Darrell? Because um, you're telling your story, uh, and you're telling your personal story to say, "Hey, these
yes,
are my personal things." If I say it, it's, well, maybe he's exaggerating. Maybe it isn't true. Oh, that
that's
that that, that
bullshit.
Yeah, that doesn't really happen.
Yeah, it's bull.
Yes.
It's bull. Like we're not like everybody's not, robotic. Everybody's not to a point where, they can handle it. We're human. We're human. We're gonna deal with things
Well,
that a lot of people is actually going to, try to speak on, but nobody's going to take them seriously. And that's why it's important. That's why you're doing this because you're seeing people and they're like, yeah, you can handle this, you can do this. It's like, no. If I'm talking about this, if I'm talking about how caregivers are suffering, they're burnt out, they're having anxiety, they're having these type of mental health issues, and y'all think that it's okay to just be like, yeah, brush it off and you'll be okay. I'll look you dead in the face and be like, okay, put yourself in my shoes, put yourself in their shoes, see how they feel. You know what I'm saying? It's mind boggling on how people think that everybody like caregivers don't have these type of feelings and things like that. It's crap to me. It's
it,
crap.
it, you have there are two things that happen, especially when somebody's been in a caregiving situation. Care is that they have post-traumatic stress after being a caregiver. Uh,
Yes.
it isn't just those that need care; it's those that have that they have stress. And they're grieving for many reasons, and they're ancillary things. Uh, what happens? What happens to them financially? What's happened to them if they have a family? There are I think where I'm going with this, there are lingering effects. It
Yes.
doesn't just, and we're saying, oh, it's for the best. They've passed on. Well, they may have passed on, but you haven't. And where are you in the situation? And I stress it again. If you had a plan and you had things in order, it doesn't make it more pleasant, but it sure makes it where where it's tolerable.
There you go. Yes.
Yeah. And look, there's also the thing. It's also the thing of, well, I don't want to talk to somebody. Well, um, here's the thing is there are lots of us. So if you and I've had people, they'll interrogate me. They'll say, who are you? What are you? And I'll go through I'll explain, who I am, and I'll ask them questions. And sometimes it just isn't a good match. It just, for whatever, either they don't trust me or it just isn't a match. Just because I'm not a good match, then go to somebody else. Try other people to see who you're comfortable with. Or if you have advisors, people that you like and you trust and have a relationship,
Mhm.
and ask them. Ask your wealth advisor, ask your financial advisor, ask your friends. Um, um, what plans they have, what are they doing, who have they talked to, what do they like about them? Um, and it's, whether you're talking to Raymond Levine, you're not talking to me so you can, because I want you to own a long-term care plan. What I
Mhm.
want you to do is to say, uh, if I'm going to do something, I'm going to buy it for the right reasons because I want it, the right plan, at the right place, at the right time, meaning I can make decisions. And if I can get you at that point where it's, now I understand what this is about, or I never thought about it that way, that's the place, that is most satisfying because it's not, oh God, I got to buy a plan. I got to talk to Raymond Levine. I got to pay a premium. Oh, I'm doing this because it's like, why do we go to school? Why do we take continuing education? Why do we do a lot of things that maybe, uh, we don't, maybe it isn't initially as enjoyable. Why do we cut the grass? Why do we take out the garbage? Well, we do it because we're transitioning from a wastewater basket out to some place else. But
Yeah.
if once you get in the habit of doing it, it's not so bad.
Mhm.
Once you get in the habit of saying, I'm going to organize things, I'm going to have a plan, I'm going to go through this process. And once it's done, it's done. Then, just make sure you pay the premiums. Look at your plan every once in a while, or call me every once in a while. Say, tell me again what it is I did. I'll talk to you. I won't go away.
Yeah.
And that's relationship because once you accept, uh, you know, people need a will. People need a medical power of attorney. People need a legal power of attorney, and they're good. They're good reason to have it, but also understand why you have. Rather, I'll say, well, I have this. Well, if I die, I have this medical power of attorney. What's it say? What's it do? When's the last time it was updated? Are you sure? Or people say, I have insurance.
Mhm.
I go back to what kind of insurance do you have? Do you have collision insurance? Do you have uninsured? There are a lot of things. So just because you say I have something, you got to say, but maybe I should also say, you have this. Is it working? Have you tried it? I haven't. I should do that. Have you tried it? It's like I'm having a disagreement with somebody. Well, what have you done? Nothing. Well, have you tried, having a conversation? Something is bothering you. What are you going to do about it? How are you?
Right.
Not what are you going to do? How are you going to? Maybe that's a better way. How are you going to find out what is the problem and figure out how to, what are solutions? And there isn't one
Mhm.
solution. But that's the business I'm in, is to say, I guarantee you at some point, younger, older, there is going to be a care issue, and
Mhm.
how are you going to deal with it, um, and how you and where are the funds coming from in order to take care of what I think is your most valuable asset is yourself.
Absolutely. I agree. I agree to that.
You do?
Yes, of course. I absolutely agree with that. I mean, you've been dead on a lot of everything that you have said. You have been dead on. Like you're speaking on so much that it is insane that people can go and be like, "Oh, I don't believe this." Like it's hard to believe that. But me, I see it because the caregiving and these people that are actually doing these things, when I've seen them, you're hitting the spot because that's what I see. I see that. I see everything that you have said. I see it. It's insane.
Well,
I
let
have
me
to believe you.
Let me ask you this, Darrell.
Sure.
With that, why is it people are not motivated to say, I see it, it's a problem. Now, what am I going to do? How am I going to solve this? What plan am I going to get in place? Because most people never say, after this comment, I'm going to do something about it. I'm going to, talk to my wealth advisor. I'm going to talk to a long-term care person. I'm going to, I'm going to do that. Most people, that I have this conversation never say, with that, yeah, I don't think I'm as organized. These are things that I'm going to work on to do. You don't have to do it on Monday. I mean, you could, you could spread it out. You don't have to take care of it right away. But to say, I'm going to put this. I am motivated enough that I'm going to schedule something. Not going to do it today, but I'm
Mm-hmm.
motivated. So how I've asked this question before. How do we motivate people to do something, to say, I need to have the conversation? How do you motivate people to have a conversation?
Okay. This is just my opinion. This is just what I believe when I answer this. Two things. When it comes down to that, procrastination and pressure. So what happens is that when they see so much information that is actually been given to them, that's when that kicks in. And it's like, how am I going to be able to do all of this? And then going back to what you said, it's better to talk to an agent in person so you could be more better prepared and not do it online. Because if you do it online, you're going to be blindsided about a lot of things. You said that. And that is the one way to actually get past the procrastination and the pressure of actually being more motivated and prepared to go and say, okay, now I understand. I asked the right questions. I've asked more questions. Now I could be annoying about asking questions, but I have to be annoying to ask these questions because I need to be better prepared. So you going online and you get blindsided about it, procrastination and fear. Not fear, pressure. It could be fear too, but it'd be more pressure more than anything. But if you actually go into a person, you go to an agent, you're talking, and you're hearing them and what they're saying. You're going to ask questions because it's going to kick. Everything is going to kick in, and you're going to figure it out. And that's where everything lays out. And you just know that, hey, I got all this information now. I know exactly where to go. I know how to prepare for it. And I have a little bit of motivation to actually move forward. Because if you did it the online way, there are things that you're skipping, there are things that you're not aware of. And when you're not aware of it, something happens, boom, your fear is kicking in. And then when your fear kicks in, you're panicking. And then you get annoyed. Then these bad phone calls start coming in.
Yeah.
Bad phone calls start coming in. And when those bad phone calls start coming in, you have nobody but to blame yourself because you did not do proper research, learning the information that you need. You need all that. You really like, and I'll tell you, for me, I'm an introvert. I really don't like talking, right? I don't like, having, long conversations unless I know what it's about. Having this conversation with you, I have some sort of idea. So I know like where I could go, how I can speak it. I can be able to have that conversation and it won't be that bad. So I'm okay with that. But then you got other people that likes to talk, but they have absolutely no idea where to go. None. And the only way that they'll know is that they gain that experience. Don't do it online. Talk to someone. Now, if you talked enough and you could go online, then you could do it that way. But it's still risky. Talk in person. Talk in person. That is the number one thing because that's where you eliminate all of your stress, you eliminate all of your depressions and everything else because you're starting to figure things out, right? Am I wrong?
Well, when I first got started, I did home visits. I haven't done a home
Sure.
visit in years. I do it all by, this kind of two-way communication for a variety of reasons, not the least of which is it's more convenient. And the second is that sometimes I've been in people's homes where I- I've been afraid. I mean, there's some
Yeah.
or it used to be, people were more comfortable having people in their homes. Not so often. I mean, it depends in the situation. I mean, it used to be, I was where we had Fuller Brush, we had door-to-door salespepeople.
Mm-hmm.
We had home delivery of cleaning, your milk, and cottage cheese. You had actually in the street I was on, there was even a person that was selling fish. Um,
Oh.
yeah, it was great fish too.
Oh
Uh,
yeah.
yeah. So, all that's, or even doctors used to come to your home. Now it's, now you have to go to medical centers and stores. But even that's changing now. Now it's now it's reverse. It's now more home delivery.
Mm-hmm.
And so and this, it's just more convenient that I can do it on online, and I can show you a lot of things, and maybe I'm more comfortable with it. Actually, more and more people are comfortable with it. That you get a sense of do I can I relate? Can I not? How do I feel about it? And I don't have to clear off the table.
Right.
I've got into some homes that were pretty where I was having to step over things, uh,
Oh yeah.
and or also sometimes I'd say something or they say something, and it just seemed to be uncomfortable. Some people may have been better at it, calmer about it, but anyway, in some ways, it's safer for me, it's safer for them, and also, they can have they don't have to worry about somebody coming to their home. But more and more, I mean,
Mhm.
I've had physician visits where it's been online.
Yeah.
Uh, or with my wealth advisor. So in a lot of situations that's how I'll do it. Now, if you're near enough and you got to see me in person, I will see. I promise I will see you in person if it's close. But I'm not driving 2 hours
Correct.
to go and see. Not even in my electric vehicle. I'm just not prone. I'm not prone to do that.
I
But
wouldn't either.
I'm very pleased to to see you online to schedule. I'm
Absolutely.
and I can oh, before I forget, you were also talking about having access to information because people
Yeah.
they call research at my website, www.levineltcins.com. Now, let me just tell you where I'm going with this. It
Okay.
is just, hi, go here so that you'll be motivated. You want to buy long-term care insurance. Fine, if that's what you want to do. But where I'm getting at is that go to the upper left corner of my
Mhm.
website.
Yeah.
If you want to, and then you can put in your health history and your lifestyle history, and it will give you an idea of what your longevity might be when it might be possible that you will need caregiving. And then it'll go into how much it costs, because you can visually see it. It isn't just, say how much is caregiving cost? I don't know, 200,000, or you'll read about it, 150,000. But there's something about if you read it, if you read it and then you look at it your own life, because that's the life you really are interested in is your life and your
Yeah.
is when am I what am I costs? And then you can look to say, how much money do you have in reserve that you're willing to spend on your caregiving? And if you don't, then either buy a plan or there are other options. Sell your life. I always say never drop your life insurance. Never drop your life insurance. So
Absolutely.
if you need to sell it, whether if it's a term policy and you can convert it, or you have a whole life policy, don't drop the plan and get the cash. Sell it. You'll get more money. It's much better. Sell your plan. Reverse mortgage. There's subscription plans. There's short term. They're all kind. I mean, if you have no life, no money, then you're on Medicaid. But again, you got to qualify for it. Now there are people that will say, well, I've got assets, so I'll transfer so I can get Medicaid. I'll just say, for elder care attorneys that do that, I don't know, somehow there seems to be maybe there's a rationale for it, but I don't know the rationale. Why would anybody want to give, put it in a trust, give it away to their family, which once they own it, then they can, if the purpose is to pay for your care, but then to go on Medicaid, why would I want to transfer my assets so I can be on Medicaid, so I can have some agency tell me what hours and the people. Why would I want to do that when if I have the assets or I buy a plan, whatever it may be, that I can make my own choices? Why wouldn't I want to pay my own choices? And there's also something else too. People say, well, I'll give it, I'll go on Medicaid or I'll transfer my asset. Ask an elder care attorney, and there's a fee for it. The last time I heard it was $15,000, to do this transition kind of Medicaid,
Mhm.
transfer your assets to Medicaid.
Yeah.
Maybe there's a rationale to it. I don't get the rationale. I'd rather than pay put the 15,000, own a plan or do something, and then I have control of my assets, or I can put it in trust. I can, if I want to leave a legacy, that I can make those choices. Because once you transfer it to somebody else, um, you don't have those choices anymore.
Hmm.
You've transferred the assets and the choices to somebody else. And if you understand and you're willing to live with that, that's fine. I don't get it, but if there's a rationale, and I've read a lot of articles that it seems reasonable, I've never bought into that. And
Yeah.
does that mean that there aren't good reasons to use Medicaid? Yeah, if you depending on what assets you have or you don't have, that was the original purpose of Medicaid in 1965. It was to help
Hmm.
people. I mean, easy to say poor people, but it's people that didn't have assets and income. It was to help people so that they could have medical care and caregiving. I'll say a really nasty word on this podcast that
Please do.
you may not like. Is it gives people support. It gives people benefits. It gives people dignity.
Yes.
That rather than just living on the floor, being in a bed, it was designed to give people support and dignity. So that's the dirty word that gonna it'll help you with your dignity.
I understand it because I used to be an insurance agent myself, with insurance benefits. I used to do that with Globe Life. So I understand how, some it's in bits, can process through caregiving benefits. So yeah, I definitely understand it. So it makes sense. It makes sense.
It does. It does.
Yeah, definitely. Yeah, one more question. We get on out
Sure.
here. For anybody that's thinking about benefits, anybody that's ready to or thinking about, I'm ready, let's go. What would you tell
I would tell them well, actually two things. One, if you ask your company if they offer a long-term care plan.
them? Hmm.
And if they don't, to say, would you be interested in having the conversation of having your company offer long-term care plans as an employee benefit? And it's a good deal because unlike other benefits, it's portable. You could take it with you. Number
Yes.
two, it's a good investment. Number three, if you're when you're younger, it's a really good idea to own a plan and keep it because if it has an inflation benefit on it, and it's 1,500 or 2,000. Do you realize what that plan is going to be worth in 40 years? You may never have to buy another plan or what they call stacking. In other words, you have one plan, and then that you need an additional enhanced plan. That might
Yeah.
be the only plan that you have. Or if your health changes or whatever, and you could never get it because of health, that you have that plan, they can never take it away from you, no matter what you're
Correct.
so long as you pay the premiums. So ask your company if they own a long-term care plan. The other is, even if you think that it's might be an unpleasant experience, is have the conversation.
Hmm.
And if one conversation doesn't work out well, then try somebody else. If or ask them to say, well, how do you do what you do? Now, some people will just show you a plan. They'll just show you illustrations. Bad idea. Is
Yeah.
I want to know what you're about. I want to ask you questions. I want to know,
Hmm.
what's important to you. What do you want this plan to do? Where do you want it? Tell me your story, and I'll ask you questions, and I'll say, if you had a long-term plan, how would you like it to work? Or if and to say, and also I'll ask you, look, what's your budget? And I'll give you, and they'll say, oh, I don't know. I said, well, we can tier it. Can would you be comfortable with 125? Would you be comfortable
Okay.
with 225? Could you handle 325? And they say, oh, it's too much money. And I'll say, what's your car payment? $422.62, 872. And and you're paying that for your car. would you like to pay a little bit, some money on yourself? Because I guarantee you're a big expense. You think your car,
Yes.
it's a big expense. So, but I'll tier it in order to say, within your budget, this is how I will design a plan. If you say, and then, we can adjust it and I'll show you, well, it's also based on your health assessment too. What's your health? Because if you're in pretty good health, you have more options. Not in good health, fewer options, maybe fewer plans, maybe even no. But all is not lost because I can get you a subscription plan as long as you don't need caregiving within 6 months. It's only a home care plan. It has its limitations, but I can get you something. I can also do it at the other extreme. If you have assets, let's say if you have an annuity not needed for retirement, if you have other assets
Mhm.
not needed for retirement, then we can transfer those assets into an annuity that is also has a long-term care rider that will pay benefits. In other words, to lever your money. In other words, for every dollar you put in, get $2 or $3. And then people say, "Well, yeah, but if I do that, I'll lose my money." I say, "Oh, not necessarily. Is it money not used in your plan if you haven't gone to the rider that if you die your beneficiary will get whatever the cash value is, so you're not transferring money and then people worry about losing their money. Well, I worry about losing my money too. It,
Yeah.
there are safeguards, and if it's designed properly, it may be that you have used it all and then and then it's done. But if
Mhm.
you haven't, that you haven't, lost your money. What
Yeah,
you've done
right.
is you've transferred your money, but then there is a benefit. So there are ways to do it if you have, an agent that, that understands that, to say, I'm going to design the right plan of at a that's within your budget that will do what you want to do. I mean, I've had that too, where people, especially with wealth advisors, sometimes they get a, they'll talk to me and I'll say, "Well, have you ever looked at it?" Yeah, my wealth advisor, my financial advisor designed me a plan. It was just too expensive, so I said no. So they
Yeah.
were interested, but it could have been they either didn't like the plan or they didn't understand, why they were paying this premium. And
Exactly.
yeah, uh, uh, and that's a human thing. But let me just also say, from a consumer point of view, is that never buy something because of price. Buy things because it has value. And it may, sometimes look, sometimes less is more, sometimes more is less. Sometimes if you pay more, that you'll have more in benefits, you'll feel more comfortable about it. And also, depending on your age, the younger you buy it, the premiums are less, hopefully you're in better health. And also you're buying time, meaning if you have a cost of living on it, you're buying time. So you don't have to pay, get a plan that's 7,000. You can get a plan that's 3 or 4,000, and then be 10,000, 12,000, in 20, 25 years. Um, but the premium's the same.
Yeah.
But the benefit, I mean, think of it this: go to a plant store. You can get a little potted plant that costs 50 cents or $1.50, or you can get the tree or the plant, and now it's $500 or 1,000. Same plant, same. What's the difference? You're buying time. If you
Right.
if you want the plant that's more developed, it's going to cost you more. But same
Mhm.
plan. But yeah.
Yeah,
So it's but if the earlier you're buying time, and time's expensive.
it is. It is. And most people don't understand that either.
Yeah.
They don't. So that's big. That's big information. But Raymond, I appreciate your time, man. I
I
really do.
appreciate being on the show. Actually, I had
Yeah.
fun.
I know. I did too. It like you was just speaking so much facts. And it was like so therapeutic because it's understandable. I love it. But I really do. I really appreciate your time, man. I appreciate you coming on, man, and advocating for what you care mostly about.
Thank you. My
I appreciate
pleasure.
it. All right.